The next presenter is Kedibonye Tsaone Mmachere Mareka to present on the topic an investigation of unintentional injuries in childcare settings, Mogoditshae / Thamaga Subdistrict, Botswana. Over to you.
Good afternoon. Hello, everyone, and welcome to my presentation. Let me start by saying a few words about my own background. My name is Kedibonye Tsaone Mmachere Mareka. I'm from Botswana, Southern Africa. I'm from the health field since 1982. I specialized in Master of Public Health way back as 2004. I was once a lecturer for 10 years, still in the field of health. This experience made me an all-rounder in the field of health. My talk shall be particularly relevant to those of you who have interest in children's safety and even those who will build interest as we go along in my presentation. We'll definitely see that it is designed to act as a catalyst for discussion. Welcome. Currently in Botswana, the workforce mostly comprises of a childbearing population. While they go to work, their children end up being cared in programs such as daycare centers. According to Gong et al. 2021, he emphasized that children's surroundings contain a lot of potential risks. And Phelan 2001 also found that most of these unintentional injuries occur at schools and daycare centers. And most of these injuries are predictable and preventable according to CDC 2013. Unintentional injuries are those injuries that are not inflicted purposefully. They occur without intent to harm, and typically they are preventable, more especially when proper safety precautions are followed in daycare centers during school hours. Where is the problem for this situation? If you look at daycare centers in Mogoditshae, Thamaga Subdistrict Council, they are licensed settings such as daycare centers, preschools, play schools, kindergartens, crèches, and nurseries with enrolled number of pupils in term 1, term 2, and term 3 of the school calendar. According to Tinsworth 2001, they argued that although unintentional injuries can be predicted and avoided, they still happen in various childcare settings as evidenced by literature. And that is the reason why I decided to embark on this issue. If you look at this district, there has been little work in the district exploring childcare settings, experiences of unintentional injuries in such settings. So if these unintentional injuries cannot be addressed, the cases are likely to escalate, and as a result, unnecessary lives will be lost to causes that are largely preventable. So in view of the above problems, the investigation of unintentional injuries in childcare settings in this mentioned district has incited an investigation of this nature as very, very important, relevant, and urgent. We came up with a few methods in order to get the information that we wanted to elicit from the study. So the study employed a descriptive cross-sectional qualitative and quantitative designs to gather data from the 45 identified daycare centers through structured interviews, questionnaires over a certain period in time in the past and in the present concurrent, to assess the evidence of these unintentional injuries in this subject that I've just said. And the ecological approach and the epidemiological model assisted to identify risk and protective factors for unintentional injuries in daycare centers. When I mean ecological approach, I was looking at the individual behaviors, the community factors, and the societal behaviors that can contribute to unintentional injuries in daycare centers. I was also looking at the epidemiological model, which assisted to identify risk and protective factors. And in the epidemiological factors, I was looking at the risk factors and the protective factors that can contribute to this issue. And after having, adopted, and scrutinized the employed descriptive cross-sectional quantitative and qualitative design, we gathered data from these 45 identified daycare centers. Like I said, through interviews, through questionnaires over a certain period of time. And the results and discussions came out from the 45 daycare centers. A total of 3,002 children were identified, of which 1060, meaning 35%, were half-time, and 1942, 65% were full-time, meaning that full-time children were 65 who attended full-time, and the half-time were 35, meaning that, soon after lunch, the half-time would go home, and those that would remain as full-time, they will remain in the centers to be taken care of. And out of this 3,002 children, 1,534, meaning 51% were girls, and 1,468, 49% were boys. 1962, meaning 55% were aged less than 3.5 years old, while 1,340, 45% were greater or equal to 3.5 years. A total of 1,274, meaning 42%, sustained injuries, of which 382 were girls and 892, 72% were boys. We can see from the computation that 70% were boys who sustained injuries. Of the 1,274 who sustained unintentional injuries, 573, meaning 45%, were of age less than 3.5 years old, while 701, 55% were of age greater than or equal 3.5 years, meaning that, those who are over 3.5 are the ones that had, greater unintentional injuries. And then we looked also into season, and we realized that the season was not a factor because in first, second, and third term respectively, the computation was 33%, 33%, 34%, meaning that season was not a factor to look into unintentional injuries. Of the 1942 full-time, 86, 44% sustained injury, while of the 1060 half-time, 414, meaning 39% sustained injury. Let me do a conclusion of the results and discussion of these results. And males are more likely to get injured than females. Older children are more likely to sustain unintentional injuries. Unintentional injuries are sustained in the late afternoons. Unintentional injuries are more likely to be sustained in the early and late part of the week. And like I said earlier on, season or term of study is not a factor of unintentional injuries. Amount of time spent at school is also a factor of unintentional injuries, if you look at the full time and the half time. Finally, the results and discussion of this study, they cannot be generalized or to other community location or outside the project. So they only concentrate in Mogoditshae Thamaga Subdistrict. these are the references that are used as shown on the screen. In conclusion, the current Botswana ECCE in Mogoditshae Thamaga Subdistrict is currently receiving a good technical support, largely because the local authority under Social and Community Development Office, SNCD, in the District Council, who are charged with the daycare center supervision tasks, are seeing it as their mandate to identify illegal service providers, as evidenced by submission of yearly reports on periodic inspection of the daycare centers. You can see that, the office responsible is doing all what it can to engage on periodic inspection of the daycare centers. And if I were to share with you, last year when we were to collect data, initially we had 74 daycare centers. And when we came to collect data, we realized that out of this 74, we only got 61. And soon after we have arrived at collection of data area, we realized that there were only 47, meaning that during periodic inspection of daycare centers, they realized that, there were some daycare centers that were, illegally providing service provision without being licensed. And it shows that this office, development office, SNCD, is working round the clock in order to protect children against unintentional injuries. Because there is a tendency that, if daycare centers would work without a license, it means that they don't comply to other areas that they can put, children at risk, which means this office has to be commended on the work done. And out of the injuries that were seen in these 45 daycare centers that were scrutinized, it was realized that only minor injuries were seen. Not that minor injuries could not be looked into, but it is important that, time and again, there should be periodic checks in this area so that we have zero, unintentional injuries, because we don't know the sequela of these injuries. Future steps. We can advocate to conduct a national survey of injury prevention activities of children in the whole country to ascertain the activities that are being undertaken to prevent unintentional injuries. And again, we could also do a research whereby we can ask whether provision of extra safety care for children with impaired development and disabilities can reduce unintentional injuries in child care settings. We can also advocate for legislators to advocate for increased education budget, so that at the end of the day, daycare centers are equipped in such a way that they will have facilities that will guard against safety of children in their centers. The other future step that can be embarked upon is whereby the Ministry of Education can be sought for provision of services required for children under the age of 2.5 years, because we still don't have facilities for children under the age of 2.5 years, which means if they have facilities, they would be able to be catered for to prevent unintentional injuries, which might happen in their homes. Thank you. This marks the end of my presentation.